please.
All right, I'll be back.
Yes. Bye-bye.
Bye-bye.
Bye, Daddy.
Hey, where's Daddy going?
I don't know.
Now tell me, what are you doing here today?
Nothing if I get a shot.
Now, remember what you said earlier about getting a shot?
Yes.
What'd you say? You're not gonna what?
Cry.
This young patient doesn't have health care without this. A mobile health van donated a few years ago by Oprah Winfrey. Now Jaleese and this baby, 9-month-old Layla Warwick, get their checkups when these vans visit their Southeast DC neighborhood.
When you'll start walking?
I grew up around this area, and then I also grew up on Upsall Street, Southeast, which is down the street from here.
Layla's mom, Letitia, grew up in Southeast. She used to be a patient here as well. She then left for college. Layla changed her plans, at least temporarily.
Hi, cutie. Hey, you ready for your checkup?
I got married, and I found out I was pregnant with her.
The van starts every morning at the ARC, or the Town Hall Education, Arts, and Recreation Campus. This traveling clinic hits a different neighborhood 5 days a week, bringing health care on wheels to over 3,500 families each year. The clinic's goal? Deliver the same level of service that patients receive at the best hospitals.
You gonna lay down?
Dr. Ronique Harris runs the DC Children's Health Project. Harris says these kids needed somewhere to go when DC's only public hospital, DC General, closed.
So I came from similar backgrounds to a lot of my patients, where sometimes you're poor but you don't realize you're poor. You may not have access to medical care.
When DC General closed, many in poor communities were left with little or no health care. This caused simple and often easily treated problems, like asthma, to mushroom into serious problems and far more expensive visits to the emergency room.
We spend about $6,000 a year per person in healthcare in America. That's about $2 trillion a year in America. That's twice as high per capita than the next highest country, and we're not twice as healthy. Our healthcare costs are way too high. Too few people are uninsured, and it's becoming a tragedy, frankly.
I believe that health care is a right, not a privilege, and everyone should have access to health care.
Hey.